Coronavirus numbers, they are on the rise, has a lot of people worried. In today's To Your Wellbeing, we're breaking down the new numbers and the importance of social distancing. Cone Health's Chief Physician Executive, Dr. Bruce Swords, is joining us now. So, Dr. Swords, let's talk about this. Cone Health has been caring for, 90 plus COVID-19 patients for the past several days. And this alarms you. Tell me why.
It sure does. Thank you for having me. We have 90 plus patients in our facilities for the past several days, even over 100 at times. And what's concerning is that a few short weeks ago, maybe 8, we had 1/3 of those cases in our facilities. And so what's concerning is the rapid rise in the number of patients that we have, from mid-30s to upwards of 100 patients in our facilities. And that rapid rise is concerning because we don't see that tapering off anytime soon.
And I think when a lot of people heard that the number of cases was going up, I think that they were assuming that it was just people testing positive, but not people being sick. But this is a totally different thing that we're talking about here.
That's right. It's both. So there are more people testing positive, and that's because there's more coronavirus in our communities. And a subset of those people who are infected get extraordinarily sick and require hospitalization. And unfortunately, as we know, some of those patients die.
I know that Cone Health, and we're trying to think of, okay, do they have enough beds to take care of these patients that you have now? And if you're thinking that it's going to exponentially go up in the next couple of weeks?
It's a real concern. Certainly we have the number of beds and staff members and doctors and nurses to take care of the patients we have now. And we will do everything we can to take care of as many patients in the future as we need to. But our resources will get constrained, and we may have to start shifting resources to the right patient. We don't know what that will look like, but we have to get this under control now.
All right, so when you say that you might have to shift it to the right patient, what does that mean?
Yeah, we're not even sure what that means. We do know that if resources get constrained, there may have to be some really tough decisions that are made. We can recall many months ago in European countries where doctors had to make really tough choices about who was going to get what care. And thankfully, we haven't had to do that. We don't think we will have to do that, but it all depends on how engaged our community members get in controlling the virus and the spread of the virus.
All right, well, let's talk about that, about what do we need to do as a community differently?
Tanya, we've been talking about this for several months, and I'm not sure anything needs to be different other than everybody needs to participate. And so we know what works. We know that wearing a mask, a real mask, works. We know that you need to wear the mask over your mouth and your nose, not under your chin or just over your mouth. We also know that you need to stay away from each other and distance yourselves while wearing a mask. It's not one or the other, it's both. And then, of course, wash your hands, because the virus can stay intact on solid surfaces. So the message isn't doing anything differently. It's everybody has to participate. And unfortunately, not everybody has participated in these COVID rules that we've designated.
Mm-hmm. So I know some of the recommendations from, like, the governor are encouraging people to change their holiday plans. And what is your thought process on this as people really are having these conversations with their family members about what they're going to do?
Yeah, these are really tough conversations. We are so used to getting with family members and other loved ones during the holidays that these are really tough conversations and tough decisions. I think the recommendations that are in place now are: keep your gathering small, so less than 10. And if you are celebrating with people who are not your family members, you have to follow these rules that I just outlined. Wear a mask even in your house. Stay away from people even when they are in your house. In the best of all worlds, those folks who can cancel their plans and do something virtually, that would be better.